Welcome. You are listening to the Be a Better Being podcast, hosted by Michelle Zellner and Sasha Berscheid. Michelle and Sasha are here to give you information and inspiration to help you live your healthiest, happiest lives. Thank you for tuning in. We hope you enjoy the show.
Greetings. Thank you for tuning in to the Be a Better Being podcast. I am Michelle Zellner. I'm super delighted to be joined by my guest today because I've known her husband for quite a few years. We work in partnership in the wellness space, but she is a wealth of wellness herself. And given that October is Dental Hygiene Awareness Month, and this is a topic I've been wanting to talk about for a very long time, I thought, what a better way to bring on Megan DeWalt than to have her during this month. So Megan, thank you for joining on the show.
Oh, Michelle, thank you so very much. It's my pleasure to be here. I'm happy to talk about all things dental hygiene and beyond.
Yes. Well, like so many other things, this is such a critical area that we are never taught, or we just are kind of taught the very basic surface, like brush your teeth, floss so you don't get cavities. And yet there is so much more to our oral health and so many things that we should be aware of earlier rather than later that could probably prevent a whole bunch of things from happening later. And I just think we're very uninformed about it. So really excited to have this conversation. Let's just have you introduce yourself, how you got into this industry, and then we'll talk about the really incredible things that you're doing currently.
Oh, sure. Thank you. Yes, I totally agree in everything that you just said, though. I've been a dental hygienist now. I've had my dental hygiene license since 2006. I had a previous career, but believe it or not, as a kid, I loved going to the dentist and getting my teeth cleaned. It was really ingrained in me from when I was a child and just didn't pursue it because I just wasn't interested in at the time after high school. And then after college and I pursued a different career, it was always kind of itching at me. So I knew it was my place to get into the dental field. So I went back to school. Graduated in 2006 and then practiced dental hygiene for 15 years in private practice. And then I have since moved on to something that's called myofunctional therapy, an area of dentistry as well.
Well, I want to circle back to you as a kid because I am willing to bet you are in a very rare, percentage of people who likes going to the dentist. Tell me, like, as a kid, what about going to the dentist did you like? And since you've been on the other side of the chair, what do you see with people as to why they don't like it, why their hesitation is there, and maybe, why they don't go as frequently as they should?
Sure. My dentist as a kid was my mom's dentist that she went to when she was growing up. And so it was kind of a big deal for us to travel to her hometown where we got to see a dentist. So we would travel 45 minutes to go to the dentist, to go back to her hometown. The dental office itself was, of course, very welcoming. The dental hygienist, her name was Sue. She was fantastic. It was just my conversations with Sue and just her demeanor as I was in the chair that made me really comfortable. Believe it or not, you guys may or may not remember the old fluoride treatments that we used to have as a kid. I even used to love choosing that flavor for the fluoride treatment. And then after our dental visit, we got a really special treat if my mom would take us, out to lunch afterwards. So it's just a really comforting memory, believe it or not.
Well, I love that. And I think if more people had that kind of experience earlier, maybe it would get people to really understand why their oral hygiene is so important. So even back then, and grew up in a small town. I remember our hygienist, Pam forever. Pam, obviously, at some point retired, moved on, but it was well past I was already, beyond college and living out here. So I think those early connections with that person who does make you feel comfortable and welcoming, so important for something that is generally uncomfortable and, maybe a little painful sometimes or a little bit scary and uncertain. How much education, even, as a child, as a teenager, as an adult, was there the educational piece of why this is important, what we're looking for? Because I have to tell you, I am 50. I just learned not that long ago a few really important things when it comes to the way I brush and floss and water pick and how that goes and why, and I think, gosh, if somebody would have told me this 30 years ago, like it's so simple, but nobody ever told me. They just do it and they just say, oh, just floss and brush. Well, except there's actual technique and there are like the visual of what you are doing when you're flossing. You're not just getting stuff out of your teeth, you're scraping the stuff off the side walls of your teeth. I don't know, maybe I'm just rare and I just never got taught that, but I have a feeling there's a lot of people that have never fully understood that piece of it.
Yes, and we now know, I do think that maybe back then, as at 45 years old as well, maybe back then, our providers potentially didn't really didn't have as much knowledge in regards to that mouth-body connection that is truly there. Our providers today, we do so much continuing education and we do so much research in regards to that mouth-body connection that is so, so important. So that's kind of my answer to when people do ask me that question. I hope that, of course, those providers at that time were absolutely doing the best they could possibly do, just with the knowledge that they had.
Well, and I will assume that as well. But I also hope for people now listening, if you have kids, I'm always about the why. Okay, I know I should do this, but why? Mm-hmm. What exactly is it doing for me? Mm-hmm. And kids are very smart, right? If you educate them and teach them, not just you have to or you should, but here's why, here's what it is doing for you and how it's going to help you, maybe they're more likely then to get into the habits of doing those things. Because I know most people don't really get into the habits of flossing, maybe until they've had some issues. Mm-hmm. And their dentist is like, look, you really need to start doing this, right?
Absolutely. Absolutely. Yes, I completely agree with that as well. We don't really explain why. And it is very important for our dental hygienists and dental providers out there to explain why it's so important, not just to brush and floss our teeth, but we are actually disrupting bacteria that's in the mouth. We have good and bad bacteria in the mouth, and it's imperative to have a good balance between the two. We don't want an overload, of course, of negative bacteria in the mouth that will have an effect, again, on that body connection. So it's imperative that our mouths are clean in order to have good lung health. That, remember, our mouths are connected to our lungs, our mouths are connected to our bloodstream. And so any bacteria that's in the mouth can absolutely be traveled into the rest of the body.
Yeah, and that's actually really what I want to dive a little deeper into, right? It's so common sense that our mouth is literally the gateway to everything. We breathe through it, we drink through it, we eat through it. Mm-hmm. Everything that ends up in our body somehow goes through the mouth. Mm-hmm. Which is why it is a little bonkers that we don't learn more about it. So let's talk about, how issues in your oral cavity could impact issues everywhere else in your body. Can you walk us through to have, just kind of the lay person's understanding of that?
Certainly. So there's that connection between the bloodstream. So when we've got bacteria sitting under the gums, which is typically where it sits, because we usually do a great job brushing our teeth, potentially flossing our teeth, or maybe using a water pick. But bacteria tends to harbor below the gums, which is where it causes havoc. So we can experience gingivitis, which is just inflammation of the gums. That's just very superficial, that we start to experience some bleeding, tenderness of our gums, but that absolutely can lead to what's called periodontal disease or gum disease. Periodontal disease is an active infection in the gums where it starts to eat away at the bones that are responsible for holding our teeth in. Below the gum line, we do have vascularity, so that bacteria does get into the bloodstream. It has been linked to early term pregnancy. It has been linked to heart disease. It has been linked to Alzheimer's. And so it's about the bacteria entering the bloodstream.
And, the standard go twice a year, every 6 months, get your good cleaning by a professional. I mean, where did that protocol come from?
Certainly. So typically a healthy adult should be going to their dentist for a dental hygiene checkup about every 6 months. And the reason that 6 month time period has kind of evolved, and some need more, some do need 3 to 4 times per year. The reason that 6 month time frame has kind of evolved is because of the amount of time it takes for what we call the biofilm to be created. So bacteria that are under the gums or on the teeth, they are really, really smart bacteria. So the bacteria, they protect themselves from our toothbrush, from our floss, and they create what's called a biofilm. That biofilm, we like to think of it like a little scaffolding area, or we like to think of the biofilm like a scaffold. And then in that scaffold, we've got lots of different bacteria. But they've got this beautiful protective measure against external forces like toothbrush and floss and water pick. That biofilm is their habitat. That biofilm is where they talk to each other, they feed each other, they take care of each other, and they communicate. So we need to disrupt that biofilm, and that biofilm typically starts to really build up, if you will, in about 6 months' time. So it's really important every 6 months that not only are you cleaning your teeth on a daily basis and you're doing a decent job disrupting that biofilm, but we really need our dental hygienists to get in there and completely disrupt that biofilm in order to really have an effect on our dental health.
And is that film, is that plaque? Is that eventually what turns into plaque, tartar? Can you give us a few of those definitions that we probably hear all the time, but maybe don't exactly know what they are?
Certainly. Yep. So plaque is what we like to call the soft stuff. A tartar is the hard calcified plaque. But within that plaque is, yes, biofilm. And so the plaque is simply bacteria. So if we have plaque on our teeth, we have bacteria built up on our teeth. The bacteria don't live forever, of course. And so as the bacteria die, they start to calcify. So if that soft plaque, almost like if you were to take your fingernail and scrub it across your teeth, if you had forgot to brush your teeth last night, you woke up in the morning, you can absolutely scrape some biofilm off of your teeth, because that biofilm starts to accumulate the second you walk out of that dental hygiene visit. And so the plaque is the soft and the tartar is the hard. We, in our everyday life, are not able to remove that tartar on our own. So again, we've got to go and see our dental hygienist. And the more frequent we go see our dental hygienist, and based on their recommendation, 3 months, 4 months, or 6 months, will help you maintain control over plaque and tartar buildup. When we don't get control over that tartar, that's when things start to hurt a little bit. And the reason things start to hurt is because that bacteria is now causing inflammation. Inflammation, a buzzword. Nobody likes inflammation. We don't like the inflammatory process. So as the dental hygienist is getting their instrument under the gums, being that the gums are inflamed, it can be quite tender. So if you stay on top of your dental hygiene visits, I promise it will help with the sensitivity of our teeth and our gums.
And I think there are so many things that can go astray, right, in our oral cavity, from just genetically how we're structured to maybe the care we did or didn't have as we were growing up, maybe things that we had done like braces that could have altered things, had teeth pulled out that might have shifted some things, our bite, how we're maybe sleeping, are we breathing with an open mouth, with a closed mouth, what we eat, what we don't eat. All of these things impact the development, the formation, and then the overall health of our oral cavity. I want to talk specifically about nutrition for a moment, and some of the things that maybe you've seen. You and I are about the same age, as maybe dietary habits have changed a little bit. And if you're seeing any changes also in whether it's the formation of the jaw structure, the teeth structure, and or just the overall health of that you think is maybe specifically tied to those changes in dietary habits.
Great question, or great comment, Michelle. So absolutely, our nutrition plays a huge role. We are at the very surface level. We can think about, oh gosh, we don't want to get any cavities, of course. So we know we equate sugar to cavities. So we all kind of know that excessive sugar can cause enamel to start to break down. However, it is so much more than that, just like you said. So the foods that we eat can have an impact on the cleanliness of our teeth. And so it is always desired, if we were to kind of go back to before the Industrial Revolution, our ancestors really did not eat any processed foods or refined foods. We have lots of documentation out there right now. If you look at old pictures of those ancestors, they have beautiful, wide jaws with straight teeth, minimal cavities. And the reason for that is because they had a very primitive diet. Lots of foods that are crunchy and hard and tearing, and we're utilizing our teeth and our jaws in order to survive. As the Industrial Revolution hit, now we started creating processed foods, refined foods. Now we're talking about softer foods, easier foods to eat, processed foods, increased sugar. All of those things have an impact on what we're seeing in regards to what we see genetically now. And so when there is a buzzword out there, it's called epigenetics. So epigenetics just means that we have our genes, but they can be expressed differently based on our environment. So for example, if we have a certain gene present, but if we are in an environment where all we're exposed to is processed or refined foods, that gene can be expressed much differently. And so that gene can then equate to different structural changes, the vitality of our teeth and such. What we eat really plays a role in regards to the health of our teeth, but also the shape of our jaw and growth and development as we're talking about potentially orthodontics.
Well, and not just orthodontics, but even something that we're going to talk about in just a moment about the actual passageway to get air into your body. The way I visualize it, it's like your teeth are bone, right? So just like any other bone, they need to have force applied to them in order to create themselves to be strong. That's why we strength train, right? Because the muscle contraction, the force on either side of the bone helps to keep that bone nice and strong and dense. Well, if I'm not chewing and crunching on hard things, but I'm drinking a lot of things, my calories, or very soft things, there is no force being applied to those bones. And so just like everything else, you don't use it, you lose it, they become weaker. And maybe that in itself is also going to snowball into, some of the gum issues that we have, because now I have a weaker bone structure means there's maybe a little loosey-goosiness going on up in there. And then there's space where the bacteria can hang out, they can grow, they can have their parties and, really wreak havoc on us. So I want people to hear this, because you have to chew food. You have to crunch. You have to bite. You can't just drink your calories, eat your soft things. You got to give your teeth a workout. And your kids, you got to give their teeth a workout, right? So make sure that people are eating crunchy, hard things so that we can hopefully build those bones and have the nice structure that we were designed to have. Let us shift in now to where your career has gone and the things that you're doing now that are, obviously incredibly important. And I am going to guarantee almost nobody has heard of this, at least not my listeners.
Very good. And that was a perfect segue. So exactly, we need to be chewing our food for the development of our jaw. And so let me kind of speak to that just a little bit, and then I'll transition into what's called myofunctional therapy. If we're not chewing, if we're not using our teeth in order to stimulate bone, we are getting underdeveloped faces. And what that means is that we can have underdevelopment of the maxilla and the mandible. And so when we are not utilizing the structure, we get a smaller space and potentially a recessed jaw. So our mandible is an isolated bone that is not connected by anything but muscle and tendon. So that mandible kind of hangs out here. This mandible is really dependent on chewing and proper function of these muscles. So when we don't have that action going on, now we start to see structural changes. The structural changes that we see is what really I identified in my dental hygiene chair. I was like, well, gosh, why does this patient have so much gingivitis, but they have beautiful dental hygiene habits? Or why does this person's teeth keep shifting? Or gosh, why does this person keep grinding their teeth even though we've given them a night guard? All of these things I saw in my dental chair, I was like, gosh, there's got to be an answer to this. Lo and behold, I went to a dental hygiene conference that had a class on what's called myofunctional therapy. I had heard of it before, so I was interested in going to the class. And as soon as I went to that class, I was sold. I was like, oh my word, this gives me all of the answers to what I'm seeing structurally and symptomatically in my dental hygiene chair. Once I discovered that, there was no going back. I knew that I wanted to start addressing the root cause of these things that I was seeing in my dental chair. Symptoms being, just like I said, cavities, clenching and grinding, gum recession, and mouth, breathing through the mouth versus breathing through the nose. And so that really kind of kicked off my career to myofunctional therapy. Myofunctional therapy is essentially, it's a very specific form of therapy where I work with the muscles of the face. So I am technically called an orofacial myofunctional therapist. Oro means mouth, facial, of course, face. Myo means muscle, and function. So I work with the function of the muscles of the mouth and the face. I work with the tongue specifically, but also the lips, the cheeks, the throat, and the palate. The reason I work on those muscles and I identify whether there's dysfunction present with the muscles is because the dysfunction of the muscle leads to what we see structurally. Muscle trumps form. So if the muscle is not working properly, then we start to see shifts and changes in the form. For example, like you said, if we're not using the muscles of the mandible, now we're seeing a deficient structure. When we see a deficient structure of the mandible, oh my word, did we realize that the mandible is the front of our airway? So if we don't have the development of our mandible, gosh, now we're taking up a little bit of space of our airway. So now our airway or our throat is narrowed. Well, narrowed airway means that we might have problems sleeping, we might not be able to breathe properly, and we might have things like sleep apnea.
And I think nobody makes that connection, right? People have sleep apnea, they go to the doctor, they get a CPAP, and we call it good. Instead of figuring out, well, why do we have this narrowed pathway or this whatever's going on? Mm-hmm. In addition to sleep apnea, what are some other maybe symptoms or signs that perhaps it is because of the malfunction of the muscles that are going on? What are some other things that you see and can correct through this form of therapy?
Absolutely. Early dental decay is a big one. Let's say we're talking about our children. I'll start it with children, then I can kind of transfer into adults. But with kids, early dental decay, because if we are experiencing, again, potentially early dental decay, but we've got pretty good oral hygiene visits and I go to the dentist every 6 months, what's going on? A lot of times the reason for that early dental decay is accumulation of buildup or plaque or bacteria, because the child's mouth is breathing through the mouth versus breathing through the nose. Our bodies were built to breathe through the nose. Our mouths were built to eat. Our noses were built to breathe. So it's really not proper function to be breathing through the mouth. When the mouth is dry, now we've got accumulation of buildup. So we've got early dental decay. With kids, we also start to see issues when we are breathing through the mouth. We start to see issues with what we call sleep disordered breathing. That just is a fancy term for when we're sleeping at night, we're breathing in the wrong way. And when we're breathing in the wrong way, it can lead to symptoms of a child that presents with very restless sleeping behaviors. So maybe they're grinding their teeth. Maybe they're wetting the bed. Maybe they're sleepwalking, sleep talking, or experiencing night terrors. Even restless sleep. With children, it's very common for them to sleep all the way through the night, but it's very active. It's very active sleep. When they wake in the morning, they can be quite groggy and then it be experiencing what we call wired but tired, meaning that the child is sleep deprived because they've been so restless all night long, not just their body, but also their brain. When our brains are restless, we kick in the sympathetic nervous system, and we can go a lot into that. But when we kick in the sympathetic nervous system, we really kind of mess with the adrenals quite a bit. So that child could be making a little bit too much adrenaline. So we call them wired but tired. So they sleep all night long, but actually they're really not sleeping restfully. They're kicking in their sympathetic. And so we get adrenaline adrenaline overdose kids, and they sometimes can get labeled as hyperactive or ADHD when really we're not taking a look at the sleep pattern. Grinding is heavily associated with sleep disordered breathing, again, because that muscle of the tongue gets out of place. So when the mouth is open, the tongue is low. When the tongue is low, the tongue can interfere with the airway. Our brain's protective measure in order to get that tongue out of the airway so that tongue doesn't block our airway is to move that jaw. So our tongue is connected to our lower jaw. If we actually shift and grind that jaw, now we're getting that tongue out of the airway. So grinding is very intermittent throughout the night, and absolutely in stressful periods of time, we can experience grinding and clenching, but typically kids are not stressed to that degree where they should be grinding their teeth. That's kids. In regards to adults, we see very similar symptoms, if you will, but a little bit morphed and not quite the same. So with adults, when we're experiencing sleep disordered breathing, we are experiencing more interrupted sleep. So the same process is happening. That adult is still creating increased adrenaline because the brain is kicking in the sympathetic. But we, as adults, we tend to wake frequently. We tend to wake with a feeling of, oh my gosh, my heart is racing. Or we tend to wake with difficulty returning to sleep because we're responding to that adrenaline. We're still clenching, grinding, and experiencing inflammation throughout the night, just like kids are, but it's just a little bit of a different pattern. So when our adults don't get restful sleep, they wake up in the morning, of course, feeling fatigued, and then that fatigue continues throughout the day. They do experience a lot of congestion as well. So congestion is highly associated with the inflammation associated with sleep disordered breathing.
And my guess is few, if any, people think, oh, it's because my tongue is in the wrong place.
Yes.
Right? Yeah. Well, I mean, this is fascinating. I'm already thinking of myself, and I'm like, I need to come see Megan. Pretty sure I need to come see Megan. So before we officially wrap up, is there anything else that you want us to know that we haven't covered yet? And then, I mean, obviously you're here in Colorado. Is there any way for anybody who doesn't live in Colorado to get your services? And if not you, how do they find someone like you where they are?
Yes, absolutely. Myofunctional therapy is really, again, based on our increased knowledge base. Myofunctional therapy is really becoming more prevalent, which is fantastic. So I am actually a virtual practice. I've been all virtual since I started my business in 2018. So I am available to anyone in any country, and so happy to provide services to anyone. If you are looking for someone a little bit closer in your area, we have a wonderful directory out there that's called Airway Circle. So if you go to airwaycircle.com, our network of what we call airway providers, it's a big network of airway providers, and we've created this directory in order to have patients be able to go to find a myofunctional therapist or potentially what we call an airway orthodontist. Because with that less development of the jaw, it's sometimes not just the lower jaw, the upper jaw, but with this deficient growth that we have, orthodontics can be very important and imperative for that person. But we do have out there what's called airway orthodontists that are focused on making that connection between the mouth and the airway and the body versus just thinking this mouth is just like this little box in the middle of our head. So every orthodontist out there has the best intention. It's just that some potentially have a higher knowledge base when it comes to airway orthodontics.
Well, that is fascinating. I am really excited to hear that you do things virtually, because I'm already thinking about other people that I know that I'm like, ooh, I think they should reach out to Megan. So this has been great. We'll put all the information in the show notes so people can find those links easily. Megan, this was wonderful. Thank you so much for sharing. I know a lot of people, I know I'm going to get a ton of feedback like, wow, I've never heard that. Mm-hmm. So super grateful that you came on with me today. And everybody listening, I mean, you heard it. So if you have not, number one, really taken care of your oral hygiene, let's start. Number two, if any of these symptoms that Megan talked about are maybe things you're experiencing, I mean, let's check it out, right? Because I know as somebody who has chased symptoms, not necessarily related to my, stuff going on with my mouth, but just with other things, you chase symptoms, you put a Band-Aid on it, it's still a problem. And now that we know that there is a root cause to so many of these things, and it probably has to do, at least in part, to the structure and to the muscular activity or inactivity, maybe that is the answer that, you've sort of not found yet because you didn't know you even needed to look for it. Once again, Megan, thank you so much. And everybody, you are listening, now you get to go and be a better being.
Thank you for listening to the Be a Better Being podcast. Michelle and Sasha hope that what you heard today inspires you to embrace this journey of life with an open mind, a kind heart, and a willingness to learn and evolve. If you enjoyed the content, please help spread their message by subscribing, sharing, and leaving a 5-star review. If you have a show topic idea or would like to be a guest, please visit betterbeings.net and fill out a contact form. Until next time, go and be a better being.